We're going to learn about the fatty liver disease today. How we monitor it, excuse me, how we monitor it and how often, when to act something more than monitor. Fatty liver disease is simply fat in the liver. It happens from many things. Most commonly, it happens from alcohol use or obesity as well. When it happens, fatty liver disease itself doesn't often cause some symptom or discomfort, but our main concern is the fatty liver disease progressing to liver cirrhosis. Fat in the liver itself is an inflammation damage to the, somebody's calling me, let me just turn it off. Fat in the liver itself is a damage in the liver, and persistent recurrent damage eventually leads to scar tissue. Imagine you have some wound on your skin, and if it happens again and again in the same spot, it's gonna cause the scar formation there. Same thing happens in the liver. Scar formation is a fibrosis. So the fibrosis may happen in the liver. This is cirrhosis. Once you get into the cirrhosis range, then there are many other things get more complicated. There are many other conditions you have to keep an eye on, and it's related to the liver cancer as well. So that's why monitoring fatty liver disease before it progresses is very important. Nowadays, we use something called the Fibroscan. Fibroscan is a non-invasive test. It's like an ultrasound. You can see this as something like, imagine there's a brick and there's a pudding, and you hit the pudding, you shake it. When pudding is so soft, when the liver is so soft like a pudding, it's going to shake a lot. When the liver is so hard like a brick because of the scar tissues, when we shake it, it's not going to shake much. So based on with the same energy and based on how much they move, we can kind of estimate the amount of the elasticity and how soft the liver is. This is really terrible explanation about how this works, but I just wanted to make it easier to understand. That's how I understood it as well. So we use the Fibroscan. It's very easy. We just put a probe on your belly on the liver, and the machine automatically calculates it. And the stiffness reflects fibrosis stage. As I said, how stiff the liver is tells us how much fibrosis is in the liver. And American Gastroenterology Association recommends it as an alternative to biopsy. In the past, we needed a biopsy for many people, but thanks to this new technology, we oftentimes avoid unnecessary invasive technique like a biopsy. Biopsy is technically getting the real tissue from your body. Okay. All right. So let me, oh, by the way, it also measure the actual amount of the fat as well. It's now I wouldn't say it's fun, but we want to know when our body changes, when we do something, whether that's being reflected in the amount of fat in the liver. And the Fibroscan measure the fat amount very objectively. This is how often we repeat the Fibroscan. There are like F0, 1, 2, 3, 4, 5, like all the stages. The higher, the worse. With minimum amount of fibrosis or almost none, then we repeat the Fibroscan every 1 or 2 years. This is more than good. But when we see good amount of fibrosis already happening, then that changes the plan to every 6 to 12 months. This is why our office is purchasing a machine in our to measure the fatty liver disease, to monitor the fatty liver disease in our office, because we are obesity clinic, right? So we oftentimes meet our patients with the same condition. So that's what we are trying to do. And you don't have to know any of these details, but I'm just telling you, based on severity, like F2, F4, and like the amount of fibrosis, we act differently. We have next steps. We shouldn't be just satisfied with monitoring it. We have to make sure, okay, what should we should be aware what to do in case the fibrosis progress and it gets worse. For example, F2 and 4 level, we first find a hepatology for further evaluation, but we start a very intensive lifestyle change. Like we have to start the weight loss program and consider some medications that help with fibrosis. GLP-1 agonist is also one of them, and pioglitazone too. And when things are even more high risk of advanced fibrosis and cirrhosis, and same steps plus above plus evaluate for complication. When the liver hardens like a brick, then it causes many problems. Most importantly, the blood flow problem happens. Liver uh, liver is right below the heart, and large amount of blood goes through the liver to the heart. And when the liver hardens, that kind of obstruct the blood flow. So the vein, the blood that was heading to the heart, their large highway path is blocked. So it must go somewhere else. That causes dilation of veins all around. Then we call that like a varices. And varices, the problem with the varices is they can rupture. And when it ruptures, it's a massive bleeding, massive, very massive bleeding. This is most scary complication of cirrhosis. Portal hypertension also happens because of the blood pressure, blood circulation issue. We have to keep an eye on that. And when it's even higher, with the thrombocytopenia, platelet count going down, which is also sign of a liver function problem, not fibrosis anymore. Liver is not functioning now. The function, we are seeing the function problem, probable cirrhosis, and begin the cancer surveillance and screen imaging, the varices I just explained to you. We do endoscopy regularly to monitor any signs of dilation or evaluate the risk of massive bleeding and also prevent. So this is what we do when we have a fatty liver disease. It's not just, oh, you have a fatty liver disease, you have to lose weight. No, we have to act on it. And we begin with Fibroscan monitoring. And depending on the severity of the Fibroscan, the fibrosis on the Fibroscan, we monitor it at different interval. And depending on the severity of the fibrosis, oftentimes we move on to next step. Thank you so much for watching. I hope this helps you understand how we approach the fatty liver disease using the Fibroscan tool.